it's Dr. Harper. Now that you know all about how anxiety and depression can affect your desire, it's time to talk about how the medicines you might take to treat depression can affect desire. So one thing that's really important for me to tell you is that when we compare patients who have untreated depression to those who have treated depression, the treated patients always do better. So just because I'm sharing this information doesn't mean I want you to go off your medications. I just want to offer you this information so you can make a decision with your provider. Patients who take depression medication are usually on something called an SSRI. And what this does in the brain is it increases the amount of serotonin that our brain sees. And while this is great for mood, sometimes it can be bad for sexual function. And we can have resulting decreased desire, decreased arousal, and decreased orgasm. So clearly, those are not great things for sexual function. So the medications that tend to be harder on sexual function are the older SSRIs, like citalopram, fluoxetine, paroxetine, and venlafaxine. The medications that are better for sexual function are bupropion and vilazodone. So if you're on one of these older SSRIs, you may want to talk to your doctor about moving to one of these newer generation medications that have a better sexual side effect profile. In addition, we found that patients who had sexual function problems due to their depression medicines did better just by adding exercise alone. In one study, patients who were on SSRIs added exercise only 20 minutes a day, only 3 times a week, and reported better sexual function. So that's a really healthy and easy way that you can improve your function on an SSRI. So what I want you to take away from this is not that I want you to go and change or stop or taper your own medication, but I do want you to know that there are some medications that are better for sexual function than others. So with this, I want you to call your provider if you feel like this might be affecting you, and that way you can discuss thoroughly the pros and cons of changing your medications around. With a shared conversation between you and your provider, we can work together to improve not only your mental health, but also your sexual health.